Welcome back to Midnight Med. This video is on groin lumps. We will talk about the different causes of groin lumps and how you differentiate them on examination. We will then overview management options. So the different differential diagnosis, the most common thing you would come up with is hernias. And there are different types of hernias based on the anatomy, which we'll go through. The lump could also be due to an inflamed lymph node or lymphadenopathy, commonly due to STIs, infections, or also cancers. So we're thinking about things that cause inflammation in that area. There could also be vascular causes, so an aneurysm, femoral aneurysm, so the arteries being affected, or the veins could be affected, such as in saphenous varix. And that would be suspected if the patient has varicose veins or signs of venous disease. The lump could also be directly from the skin, such as in the case of a lipoma, or if there are multiple lipomas in other parts of the skin, it could be multiple lipomatosis, or a sebaceous cyst if it's pedunculated. From an examination perspective, it's important to understand the anatomy of the different hernia types. Now, broadly speaking, inguinal hernias are above the pubic tubercle and femoral hernias are below. Indirect hernias travel through the deep inguinal ring, and the deep inguinal ring is the midpoint of the anterior superior iliac spine and the pubic symphysis. Direct hernias go through the posterior wall of the inguinal canal, so the transversalis fascia, the conjoint tendon, and through Hasselbalch's triangle. Hasselbalch's triangle is not something you can usually determine clinically. It's more of a surgical diagnosis, and it's bounded by the rectus abdominis as well as the inguinal ligament. Femoral hernias, remember, are below the pubic tubercle and go through the femoral canal, and these are more likely to have the complications we'll talk about. But the borders are the inguinal ligament anteriorly, the pectineus posteriorly, and then the lacunar ligament and femoral vein. This is a schematic, a nice simple diagram showing the different types of hernias. Umbilical hernias are usually more congenital related. So examination-wise, the first step you want to think about, apart from the anatomical landmarks, are whether or not it's reducible, because that's going to give you an indication of the complications. So what is reducible? Well, reducible is basically that you can reduce or make the hernia disappear. And you do that through the defect in which they occurred. For example, through the deep inguinal ring in an indirect hernia. But this is not always, the best distinguisher. Your landmarks are the better distinguisher. And these could be reduced typically with changes in pressure, so you push in on the groin when they're standing up, and also asking them to cough, and it reappears when they cough. But the simple movement of changing position can also reduce it, so lying down and then standing up. Irreducible hernias are more likely to result in complications. For example, they can become strangulated, and what this means is you can imagine the hernia being well strangled, and this means there's reduced blood flow to the area, to the tissue, due to compression by the defect, by the fascicle defect in which it went through. And so it compresses the blood flow, it reduces the blood flow, you get ischemia. When you get ischemia, that can of course progress to infarction and necrosis. Now this can cause a lot of constant pain, but remember, if it has already undergone necrosis and it's dead, the patient may not have pain. Think of it like the diabetic with the necrosed foot toe that's about to fall off. It's painless because it's dead. And the patient may also have systemic illnesses, so there are constitutional signs, and they can be septic. This requires urgent surgery, and the management is a Lichtenstein or a mesh repair, and this can be done either open or through laparoscopic repair. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.